Welcome once again. So today we are going to talk about the recommended dosage and duration of influenza antiviral medication and patients having H1N1, or for chemoprophylaxis and patients who are at high risk of having influenza. So there are three options available. One is the oral one, and these include drug like oseltamivir, and then we have an inhaled option, and that includes zenamivir, and last one but not the least, the intravenous peramivir. So if we talk about the dosage of oseltamivir, so an adult, its dose is quite easy. It is 75 milligram twice daily, and the duration of treatment for patient having influenza having documented disease is 5 days. While if we talk about the chemoprophylaxis is offered to patients who are at high risk of having the disease, such as healthcare provider or contacts with patients having documented influenza. So chemoprophylaxis in adult is for 7 days, and the dose is 75 milligram once daily. If we talk about its dosage in children, so if the patient is younger than 1 year old, then the dose of oral oseltamivir is 3 milligram per kg per dose, and it's twice daily. If the patient is 1 year or older, the dose is according to patient weight. So if the weight is 15 kg or less than 15 kg, then the dose is 30 milligram twice daily. If the patient is having weight between 15 and 23 kg, then the dose is 45 milligram twice daily. While if the patient is having weight between 23 and 40 kg, then the dose is 60 milligram twice daily. So you can see there is incremental increase of 15 mg per kg if the weight increase accordingly. So if the patient is weight greater than 40, then of course the dose is same as like adult, that is 75 milligram twice daily. Chemoprophylaxis, as I told you, is offered to a patient who are at higher risk of having influenza, such as healthcare provider and close contacts of patients with H1N1. So chemoprophylaxis in adult is 75 milligram once daily. While if we talk about children, so it's again according to weight. So children less than 3 months, chemoprophylaxis is not recommended by FDA. But if children is greater than 3 months, then of course chemoprophylaxis can be offered. So if the children is 3 months but younger than 1 year old, then the dose is 3 milligram per kg once daily. If the children is 1 year old or more than 1 year old, then the dose is according to weight. So again, so 15 kg or less, the dose is 30 milligram once daily. If between 15 and 23, dose is 45 milligram once daily. So again, the same dose, but it's now once daily. If the children is 23 to 40, then the dose is 60 milligram once daily. While in children greater than 40 kg, the dose is just as like adult, it is 75 milligram once daily. So then we have drugs like inhaled zenamivir. So if we talk about its treatment duration in patients who have documented disease, so treatment duration is for 5 days, irrespective of whether they are child or they are adult. Dose in adult is 10 milligram, which are 2 capsules of 5 milligram, and they are inhaled twice daily. While in children, they are not recommended to use by FDA in children who are less than 7 year old. So they are only recommended if the children is 7 year or older and not less than 7 year old. For chemoprophylaxis, the dose is 10 milligram once daily, an adult and child greater than 7 year old. Last but not the least, intravenous peramivir. So treatment duration is just single dose, and They are not recommended to be used in children. They are only recommended to be used in adult, and the dose is 1 600 mg dose via intravenous infusion for 15 to 30 minutes. Chemoprophylaxis, as such, there is no evidence of its use in chemoprophylaxis, so its use is only limited to be used in adult with a single dose of 600 milligram over 15 to 30 minutes. So that's all from the treatment of influenza. Hope you like this lecture, and don't forget to subscribe if you find this video helpful.